Moving on to our second speaker today. Our second speaker today is Dr. Irene Cadogan. Irene works in the Department of Environment, Climate and Communications. She's been working with the department since 2017 and has been involved in a lot of projects in that time, involved in waste and resource management and efficiency division originally. Before she worked in the department, she was actually in education. It's always a great place to come from because you're trying to communicate things across to some of us, having that educational background will help. But she has also been involved in policy evaluation and environmental research, having done her own PhD in energy efficiency policy for the residential sector. So again, the residential sector being one of the key sources of these pollutants we're talking about. Since 2020, she has been moved to be the Assistant Principal Officer in the air quality team within the department, and she has policy responsibility for all air quality matters. That's not a small amount of work, but also involving the solid fuel regulations, the clean air strategy, support for enforcement, and communications. So communications being our key focus today, as well as national, European, and international air quality briefs. If you're not too tired before you stand up, Irene, please, the floor is yours.
Thanks, Andy. Thanks very much. You make it sound like I'm very, very busy all the time, which of course I am. So thanks very much for letting me speak today, I suppose, and for something completely different to Kevin's now. I won't have any snazzy music, so you'll have to bear with me. I also run the joy of being later in the day with presentations, so pretty much everyone has said everything I was going to say, so you'll have to bear with me. It'll be like a little revision course, I think. So I suppose I'll start off by saying, yes, overall our air quality is good, as we have been told, but there are localised and seasonal issues. But I suppose while our air quality is good, it can be better. There is still air pollution, and we know that even low levels of air pollution cause health impacts, and there is no safe level of air pollution. The two main pollutants of concern, as we've been told, are PM and NOx. PM primarily from household burning of solid fuels, and NOx primarily from traffic. So we kind of know all this, but also we know that reducing these pollutants requires significant behaviour change, and that's something that has been very clear throughout the discussions this morning. So I suppose we've covered it. More eloquent speakers have spoken about there's no doubts now between the links between air pollution and health. And we have a policy imperative to do more. So obviously we've spoken about the revision of the CAFE directive, the new WHO guidelines, and our legal responsibilities to communicate around this as well. We have increasing evidence, however, that shows the impacts of poor air quality and health are not really well understood by the public, and some of that has already been outlined this morning as well. So the evidence of poor understanding of these issues, we have the Life Emerald survey, there's a recent Eurobarometer report, our own public feedback, which we frequently get about things that we're doing. We had our solid fuel public consultation with 3,500 responses, so we got quite a good insight into people's understanding of these issues, and also media coverage, which brings its own joys. But I suppose it all does come back to these premature deaths, the lives lost, the short-term health impacts and the long-term health impacts. And I'm not going to go over these again, but I suppose just to be really clear about, while we know this and we understand it, not everybody does, and those links are not being made. As it was mentioned earlier, nobody really thinks they know somebody who died from air pollution. They understand maybe somebody with a respiratory illness, the impacts that their actions may have, even if it's not directly impacting on them. So I suppose this has been kind of touched on already. So 4 in 5 adults agree that it is a risk. Air pollution is a serious risk. Half of the adults claim they don't know about PM and NOx being the main pollutants. And then we've other research as well, which shows the public are also concerned that the government are too involved in their daily lives. Also comments like, well, air quality is good, so what's the problem? Why do we need to do more? And also querying the health messaging that, oh no, this is all about climate. You're just trying to convince us to do something that we don't want to do. And you're just saying that it's a health message. So we have to be conscious of these are genuine opinions in the public sphere. I suppose we know fires and cars, to be very simplistic about it, are the key issues, but only 1 in 14 Irish adults can correctly identify home heating as the main source of PM, and industry is incorrectly mentioned by 1 in 3. And the same, only 1 in 5 correctly identify diesel engines as the main source of NOx. Actually 1 in 4 believe this to be industry again, and 1 in 3 have no idea. So I suppose we need to be very conscious of where the public understanding is, and that's something that we are very conscious of as well. So in terms of communication around all these issues, we have some key challenges to overcome. So there is obviously a lack of awareness and interest, not across everyone, but it is there. We also have to bear in mind inequalities, disadvantage, fuel poverty, conflicting information. I'm sure if somebody was interested and they wanted to go and do a search online about air quality, they'll find lots of conflicting information, lots of different sources. Also misinformation, poor presentation of the message and confusion around the message, barriers to action. So we have to be careful about trying to get people to do things and then them not actually be able to take those steps. Lack of budgets, whether that's a household, local authority, departmental level, to actually help communicate the message and to take action. And then there's also a little bit of underuse of cooperation between stakeholders. I think it's now that we're back in the room and we're all talking to each other, we realise that everyone's doing really good work, but maybe there's slightly a lack of joined up thinking and coordination, and we could benefit a lot more from working together. So I suppose from a departmental perspective, now that we're kind of doing all the other stuff, the communication piece is really a key piece of work that we want to do more on. We want to develop a more strategic, nuanced, multifaceted and long-term approach to how we communicate this message. We feel that's required. It needs to be specifically designed and targeted, and that will be essential to increase people's awareness. And this approach should also help inspire people to take action to change their behaviours, but it also hopefully would lead to better public support for policy measures as well that we will need to introduce to reach those ambitious targets that we're hoping to achieve. And there are many examples of where behavioural change comes about as a result of good communication matched with suitable supports as well. So I suppose, how are we going to do all this? It's a question I get asked on a regular basis. So I suppose there is no need to reinvent the wheel. There is a lot of really good advice, information, toolkits out there. We can learn from previous experience, but the key thing is from moving from ideas into practical action as soon as possible. So at this stage, we're really looking to explore how we can work together better. So yesterday we had our first dedicated communications workshop. It was our kind of kick-off initial state of the environment kind of situation. So we had 25 participants from government departments, ourselves, Department of Transport, Health. We also had people from the EPA, the Institute of Public Health, academia, local authorities and other representative groups and NGOs. And it was a really good mix of people with really, really good ideas and conversation that happened. So we had 2 key sessions, I suppose. We worked through, so what are the key messages? And then how do we share those key messages? So it was only yesterday, so I don't have all the results, but I'll go through vaguely the key themes. So I suppose the emerging things, and this mirrors what we see in the research around this as well, is the importance about presenting the message in different ways to kind of capture people's imaginations and also to get them to understand in their own way. I think Eilish's story was really important, and there's more stories out there that need to be told. It also needs to be clear and to the point messaging, targeted messaging, using a variety of tools, resources and connections. There's not a one-size-fits-all approach to this. The local versus the national, this is something we spoke about a lot, and I think it was echoed here today. We need to have a national coordinated approach to this, but we can't underestimate the importance of local connections and that local trusted sources of information, and also personalising the messages through those stories as well. So some of the key kind of outcomes from yesterday, that there is a very simple message in a way to be communicated. Air pollution is bad for your health and your community. But there are much more nuanced messages that are needed because that overall message is possibly too high level. And also, it was very clear, and it's been echoed here today, that health should always be the key message. That is why we are doing this. And also there's a key role for the Department of Health, the HSE, GPs, public health, and they're essential, trusted communicators in this space. It needs to be called for solidarity for everyone around protecting clean air. We've had lots of comments where like, oh, it doesn't affect me, or I live in an area and it's grand, it's not an issue. But I think there is an overall, solidarity that we need to kind of work towards. We need clear distinction about the responsibilities and possible actions, and Pat has touched on some of those, about these are key steps that you can take. And also to be very aware of the agency of the public. So what can we expect people to do versus what they're able to do, and then the government supports that are needed in terms of helping people make those behavioural changes. Interestingly, we talked a bit about scare tactics. So are we being too nice, and is that why the message is not getting out there? So it was, they can be very effective. It worked very well around drink driving or smoking. However, we also need to be very mindful of those who cannot act, people who have less access to public transport or older homes reliant on solid fuels, and we can't demonise people, especially given the context of the situation that we're in around energy crisis at the moment. We need to focus more on positive messaging as well, around the beneficial changes your action can bring, so again, not demonising people. And that the messaging should be clear, simple, and also, while we're all used to PM, NOx, NMVOCs, all these lovely acronyms that we use, the public in general don't understand that and possibly don't need to. All they need to know is whether their air quality is good or bad and how they can make a change. And then really focus on raising awareness to protect the more vulnerable. That should always be our key focus around children, pregnant women, people with existing risk factors. And you may not be one of those yourself, but you will definitely know somebody who falls into one of those categories, and that should inspire you to take action as well. So again, we talked about local ownership of coherent national messaging. It was agreed that local messaging works best, trusted sources, the power of local radio, the power of embedding in communities, working with community groups, working with, tidy towns who unfortunately get pulled on a lot, I suppose, but local authorities, all those different community networks that are already there. But it needs to be underpinned by very clear, simple, jargon-free messaging from ourselves at the national level. We can't do it alone. And I suppose when we started brainstorming through some of the, who are we talking to, what is the message, how do we get that across, and where the impact would be and how we would maybe measure that, we produced some really good, actionable next steps. We're going to keep those to ourselves, though, for now. So I suppose what happens next, I'm going to keep in time for Andy. So we'll review the outcomes and ideas that emerge as part of the workshop over the next couple of weeks. And we're going to develop our own initial internal communication strategy. So unfortunately, for most of the people who were in the room yesterday, they'll probably get a job out of it. So we're going to be working with all our key stakeholders. We also felt, and it's one of the reasons the Clean strategy was slightly delayed, is we need to incorporate, and it was very clear through the public consultation, we need to make more incorporation of the health messaging into the actual strategy, and the communications piece is central to that. So we're going to bring that work into the finalisation of the strategy. We'll also be establishing kind of a strategic comms group just to make sure that if we do put a plan and an action together, that we have everyone that needs to be there to make sure those actions happen in the room and that there is accountability around getting those delivered. And the next big step is to take action and to stop talking and more doing. Okay, so thank you very much.